Welcome, Namaste, and welcome to Dr. Shah's Clinic. In yet another video on erectile dysfunction, we are going to answer the question, how to get rid of erectile dysfunction in the young. So remember, an individual is said to have erectile dysfunction if he is unable to maintain his erectile function for adequate penetration during sex, or if he is unable to attain an erection that's of sufficient rigidity to allow penetrative sexual intercourse. And the other thing to remember here is that if you're not, say you have tried sexual intercourse in the last 3 months for over 50 times, and say over 50% of attempts you notice that your erection is not, you're not able to sustain your erection or achieve an erection, only then a diagnosis of erectile dysfunction is usually made. Furthermore, the erectile dysfunction can be graded into mild to moderate, as well as severe erectile dysfunction, depending on the IIEF questionnaire, which is one of the best and probably one of the most objective assessment of erectile function. When you're at a younger age, say if you're less than 35 years of age or less than 30 years of age, the causes of erectile dysfunction are slightly different for younger individuals versus older individuals. So less than 35 versus older than 35 or older than 40. So with older individuals, we tend to see, diabetes, hypertension, hyperlipidemia as, more common causes of erectile dysfunction, along with functional decline, in the testosterone, which leads to ED at an old age. But with younger individuals, what we tend to see is a different set of problems. We tend to see more psychogenic problems, with younger men, anxiety issues, performance anxiety-based problems with self-confidence, more psychogenic causes in general, but that does not mean that hidden organic causes as seen in older men are not seen in younger individuals. So even in younger individuals, we tend to detect patients with elevated triglyceride levels, individuals who are in pre-diabetic state. So these are all patients who may be obese, patients who may have a higher body mass index. So these are also causes of erectile dysfunction, and there have been numerous studies. I've made a separate video on causes of ED. I'm linking up at top right hand side corner of my screen. You can watch that video. It covers comprehensively all the causes of ED. So in this video, primarily what we are going to try to talk on is how to get rid of erectile dysfunction in the young. So some steps that you can do is, number one, optimize your sleep-wake cycle and set right your circadian rhythm. Remember, you need to sleep 5 to 7 hours of sleep. I would recommend at least 6 to 7 hours of restful sleep, every day. Now, without adequate sleep, your early morning surge of testosterone is not going to happen properly. Your hormones, your male sex hormones are going to be messed up. You're not going to feel fresh, and your erectile function is not going to be good. Point number two, please do not keep, your laptop on your lap while you're working, and do not sit for a long time on your desk-based job. So even if you're working on a desk-based job, see what happens when you sit for a long time and when you work, your scrotal temperature tends to go up. And even if you take a laptop, you have the habit of taking a laptop, putting on your lap and working, your scrotal temperature goes up. And what happens is basically your Leydig cell, which is, the main cell that synthesizes testosterone in a human male, which is in the testis, in the testicular region, starts, dying. It goes into, the Leydig cell goes into what's called as an apoptosis pathway. So the cells start dying. There are a lot of studies on the topic, and what I would strongly recommend is, you don't want to do that. So please, if you're sitting for a long period of time, that itself increases your scrotal temperature, your testicular temperature. That's going to affect your testosterone synthesis. And even, if you're working with a laptop on your lap, again, it's going to generate local heat. So keep your laptop on your table and work. And if you're sitting in a desk-based job, you're working in a desk-based job, every half an hour, just get up from your chair, walk for about 5 minutes or 6 minutes. It's not going to, take much time off your job. Now, the third tip is to avoid dairy products. Now, I'm not telling all dairy is harmful, but please try to avoid milk and milk-based products, like milk powder, biscuits, bakery products that involve processed milk or whatever. In general, dairy products should be avoided because dietary changes are, in fact, is probably the best thing you can do for yourself if you're trying to get rid of erectile dysfunction at a young age. Skip the dairy products and you will definitely see an improvement in your erectile function. The first change you will see within a week to 10 days of skipping dairy products is an improvement in your early morning erection as well as an increase in your libido. And let me tell you why. The dairy products that you're taking in every other day is the highest source of dietary estrogen. And you can look up this, look up the research literature on Google Scholar. I'm telling you, the milk is probably one of the richest dietary source of estrogen. Remember, milk is not a human product. It comes from animals. Well, milk is required up to a particular age. Beyond a particular age, once your bones are fused, usually beyond 21, 22, your bones are fused and hardened, you don't require milk. So try to avoid milk. It's a very rich source of estrogen. And estrogen decreases libido. High estrogen inhibits testosterone. Your libido is going to definitely go down. Your sexual function, erectile function, everything is going to take a toll. So skip the milk. That's the third important point. The fourth important point is try to hit at least 10,000 steps per day. So try to walk 5 to 7 kilometers every day. If you walk 5 days in a week, that's all you need to do. You'll have an excellent improvement in your testosterone. And this finding has been corroborated in large scale studies like the Massachusetts male aging study. You can look that up as well. The Massachusetts male aging study put men through an 8-week, 40-minute walking sessions 5 times a week, and they noticed an excellent improvement in the baseline testosterone, erectile function, libido, mood, everything. So that these are probably, so I've given you 4 tips today. So probably the simplest things that you can do in order to improve your erectile function. So if you're young, your body is going to respond beautifully to all of these changes. And the last tip, which is a bonus tip, to improve, to get rid of erectile dysfunction at young ages. Remember to, get tested, get your sugar test, get your cholesterol checked at least once a year. If you have a habit of eating outside, if you're not living at a time when, getting home cooked food has become a challenge for a lot of us. Not all of us live with our parents. And today there is a culture of buying from outside and eating and going out and having fun, which is completely okay. But like I said, if you have adequate exercise to burn off the extra calories, that's great. If not, get your cholesterol and sugar checked at least once a year, because you may have hidden dyslipidemia. You may also have a prediabetic. You may also be in a pre-diabetic state. You won't know it, but your body will show up some clear signals, and that's something you should definitely do once a year. That's a bonus tip for you. So I hope you enjoyed this video. Please like, comment, subscribe. This is Dr. Shah Dupesh.